All right, let's get right into it. When we think about solving health disparities, our minds usually go straight to more clinics, more doctors, maybe better medicine. But what if the answer isn't about that at all? What if the most powerful tool we have is something far more basic, far more human? We're talking about trust. And today, we're diving into a story that's not just about one program's fight for survival, but about what the future of public health could, and probably should, look like.
And this whole story starts in a place you'd probably never expect, the local barbershop. You know, Dr. Stephen B. Thomas, who's the mastermind behind this whole thing, he just puts it perfectly here. For so many, the barbershop or the salon, it's more than just a place to get a haircut. It's a sanctuary, it's a community center, it's where real talk happens, and that is exactly where this incredible public health strategy was born.
You see, the fundamental problem they were trying to solve wasn't a lack of medicine. It was a deep historical gap in trust. For a lot of minority communities, the healthcare system isn't exactly a trusted partner. And this comes from a long history of things, from systemic issues to really damaging events like the Tuskegee study. And this isn't just stuff from the past, you know? It's an ongoing problem that creates very real barriers to people getting the care they need today.
So how in the world do you start to fix a problem that big? Well, you don't just build a shiny new clinic and expect people to show up. You go to them. And that's the whole idea behind what's called a hyper-local solution. It's about weaving health services into the places that people already know, the places they already trust. It's about meeting people exactly where they are.
And this is how it worked in practice. It's just brilliant. The Maryland Center for Health Equity created something called the Hair Network. So first step, they train the barbers and stylists themselves, people who are already trusted figures, to be community health workers. Then they turn the shops into these pop-up clinics for things like wellness screenings and vaccines. But, and this is key, it doesn't feel like a sterile clinic. It's a celebration. There's music, there's food, it's a festive atmosphere filled with respect. And the result? It actually moves people from being hesitant to feeling confident.
And we're not talking about a little pilot program here. This model has been working and working well for over 15 years. Now, this is the part I find absolutely fascinating. Look at the nuance here. The goal wasn't to change someone's entire belief system in one afternoon. People might have walked in with their doubts. And you know what? They might have walked out with those same doubts. But they also walked out vaccinated and protected. Why? Because the environment was built on trust, not on pressure.
So you've got this amazing, proven model that's been saving lives for more than a decade. Everything's going great, right? Well, a storm was brewing. The entire foundation of this incredible trust infrastructure, which was built so carefully over all those years, was suddenly, and seriously, at risk of collapsing. And it all comes down to this number, $500,000. That's it. That's the one-time investment that was needed to act as a bridge to preserve this entire network, an infrastructure that, remember, took 15 years of relationship building and hard work to create. It was literally the amount needed to keep the whole thing from falling apart.
So you have to ask, why the sudden crisis? Well, it was really a perfect storm of factors. As you can see, a bunch of the federal programs that supported this kind of work got cut or put on pause. On top of that, the whole political vibe changed. The momentum for health equity that really surged during the pandemic started to cool off, and in some circles, the term itself got labeled as a controversial DEI initiative. All of this just made the funding environment incredibly difficult.
And the stakes couldn't be higher. I mean, we're not just talking about losing funding, we're talking about losing a 15-year network of real, trusted community leaders. We're talking about a physical space, an innovation lab in West Baltimore, a critical training program for the next generation of public health leaders. This is a tangible, working, life-saving infrastructure that was facing complete erasure.
This quote from the source material just nails it. They call it the Valley of Transition. It's this idea that you have a program that is scientifically proven to work, it's effective, it's exactly what we need, but the world of funding and politics just hasn't caught up to its success yet. So it's stuck in this dangerous gap between being incredibly valuable and actually being supported.
But this is not a story about giving up. It's a story about being incredibly resilient and creative. Because when they were faced with this crisis, the team didn't just try to find a Band-Aid. No, they designed a full-on pivot to a completely new, more sustainable model. It's a model that could be a blueprint for how other essential community programs can survive, even when the traditional support systems dry up.
Just take a look at this slide. You can really see the shift in thinking. The old way of doing things was fragile, right? It depended so much on federal money, which, as we saw, can just disappear depending on the political winds.
The new model, though, is built to last. It's all about diversifying, bringing in money from different places, building partnerships with private companies in the community, and, this is huge, developing a fee-for-service model so they're not so vulnerable to these shocks.
And here's where they got really creative. I love this. They've packaged their new services as the Nepenthe Observatory and laid it out like a menu from a fancy restaurant. So now other researchers or health groups can order from them. You need trusted access to a specific community for your research? That's the first course. You need help recruiting people for a clinical trial? Order the main course. It's a genius way to turn their unique expertise and their network of trust into a real sustainable service.
So this isn't just a dream. They have a very clear strategic plan. This timeline shows exactly how that $500,000 bridge fund gets used over 18 months. The first 9 months are all about preserving, keeping the key people and programs stable. At the same time, they start to pivot, building out that new fee-for-service model. And then, the final stage is to grow, using this new, stronger foundation to go after major grants from a position of strength, not desperation.
And the ultimate vision here, the big dream, is even more powerful. This isn't just about saving a program at a university. The long-term goal is to build a community-owned cooperative. That would mean the barbers, the stylists, the actual community leaders would have a financial stake and real power in deciding what kind of research happens in their own neighborhoods. That is a radical and really exciting shift in power.
So all of this leaves us with a really critical question, one that's a lot bigger than just this one program in Maryland. This whole story is kind of a test case for the future of public health. It forces us all to ask, as the funding disappears and the politics change, can this kind of community-led innovation build a future for public health that's truly resilient? Because honestly, the answer to that question could define whether we actually succeed in building a healthier, more equitable world for everyone.